Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Antibodies present in the dermatomyositis. So this is important. First we start with the anti-MI2 antibodies. So anti-MI2 antibodies is directed against the helicase implicated in the nucleosome remodeling. So it is directed against the helicase implicated in the nucleosome remodeling. So it's present in the nucleosome remodel. So they show a strong association with the prominent Gottron papules. So they show strong association with the Gottron papules as well as the helicotropic rash. So HT rash. Next is the antigen antibodies. So under the antigen antibodies, it is directed against the enzyme histidine tRNA synthase. So it is against the enzyme histidyl. So it is a histidyl tRNA synthase. So they are associated with the interstitial lung disease. So they are associated with the ILD, that is interstitial lung disease, as well as a non-erosive, as well as a non-erosive arthritis. So this is the anti-Jo. So they are redirected against the enzyme histidyl tRNA synthase and is associated with the interstitial lung disease, non-erosive arthritis, as well as the skin rash. The skin rash is described as the mechanic hands. So skin rash is recognized as a mechanic rash. So we saw the anti-M2 antibodies, antigen antibodies. Now lastly we'll see the anti-P155. So P155 and P140 antibodies. So this is directed against the several transcriptional regulators. So it is against the several transcription regulators and they are associated with the paraneoplastic and the juvenile cases of the associated with the paraneoplastic as well as the juvenile cases. This is of the dermatomyositis. To learn and grow daily like this, please do subscribe.